Please go ahead, Sarah.
Hello, everyone, and welcome to this year's UNC Water and Health Conference. My name is Sarah Lebu, and I'm a PhD student at the University of North Carolina and working with the Water Institute. I would like to express my deepest gratitude for you all for joining us here today. I would like to make a few announcements before we start. So first, we are really pleased to be offering interpretation services, and we'll be having interpretation services for the following languages. We'll be interpreting from English to Arabic, to French, Hindi, Portuguese, and Spanish. If you need the interpretation services, please use the interpretation tab on Zoom. And thanks to the Bill and Melinda Gates Foundation for making this all possible. We would like to highlight a couple of events. We will be having networking events lined up throughout the conference week. The networking and sponsors events happen every lunch hour Eastern Time via the conference website Pathable. The afternoon networking sessions will happen on Remo, which is a different platform. Instructions to sign up on Remo can be found on the conference website. We will also like to highlight the Career in WASH for Young Professionals event that will take place on Pathable later on today. Please tune in to collect with colleagues from far and wide. We also have a lineup of exciting events for you today. After this plenary session, we will have 4 different side events. They will be on policy and equity, on water, on sanitation, and utilities. Shortly after that, we will have some lunch events and sponsor booths on a range of topics. In the afternoon, Eastern Time again, please tune in for more verbal and poster presentations. Again, this is a kind reminder to attend the Careers in WASH for Young Professionals event that will be on Pathable, and the networking and sponsors events on Remo later today. We will be running the late early show tomorrow, especially for participants who will not make it for today's live sessions. Dr. Regina Suter and Alexander Winshaw will be giving a recap of today's lessons and how you can apply those to the Southeast Asia and the Pacific region. Please don't miss out on this one. And we will also like to say that tomorrow we will be having another plenary discussion. Please join us for a plenary discussion titled, "Why do WASH inequalities endure in high-income countries?" We encourage participants to stay till the end of this plenary discussion, where we'll be making an announcement on the winners of the Urine NSYNC Memorial Prize. Please stay tuned. Thanks to all our sponsors, it will not have been possible to bring this event to all of you. I would particularly like to highlight the support of the German Cooperation, the GIZ, WASH in Schools Network, and Chemonics. Thank you again for your generous support. Without further ado, I would like to introduce you to the moderator for this plenary session, Dr. Oliver Cumming. Dr. Cumming is the director of the Environmental Health Group at the London School of Hygiene and Tropical Medicine. His research focuses on the epidemiology of water, sanitation, and hygiene in settings with a high attributable disease burden. He currently serves as the principal investigator for several studies that assess the impact of water, sanitation, and food safety interventions on childhood enteric infections, on undernutrition, and also oral vaccine failure. And he does this across multiple countries and in diverse settings. Dr. Cumming has advised a range of governments and international agencies on matters of policy, especially those that relate to water, sanitation, and public health, and he has published extensively in this field. Please join me in welcoming Dr. Oliver Cumming. Dr. Cumming, over to you, please.
Thank you very much, Sarah, and it's a great pleasure to be here. And thanks, of course, to UNC. I don't think any of us imagined or possibly hoped that we would be doing this remotely, but the last couple of days have been just fantastic, and I hope we can continue in that vein with today's plenary session. Moderating is, of course, very easy if you have brilliant speakers and an engaged audience, and that is exactly what we hopefully will have today. I thought it might be worth just answering a question that some of you might be asking yourselves, which is why and how did we choose this panel? Well, it was easy. We wanted people that are smart, but also people who are sensible. And most importantly for you in the audience, they are not afraid to engage with big issues and pose difficult questions. I'm going to introduce them all now, and I'm going to start in Chapel Hill, where of course the University of North Carolina is, and then I'm going to move down to Brazil. I'm going to move across the Atlantic to Ghana, and then I'm going to move up to the United Kingdom, and then finally across to India. So the first person I'd like to introduce, and he can maybe turn his camera on, is Dr. Joe Brown. Joe is a licensed professional engineer, registered in both the states of Alabama and North Carolina, and he's currently an associate professor in the Department of Environmental Sciences and Engineering at the Gillings School of Public Health at UNC. Joe has really quite broad research interests covering water sanitation technologies, environmental health, microbiology, and really the role of infrastructure in protecting public health and well-being. He has a lot of interesting research underway, but I'd flag maybe particularly the work that he's been doing over the last year or so to use fecal waste streams in public health surveillance, particularly over the course of the pandemic. The other thing I would say about Joe is that he's not afraid of big questions, and he's made many major contributions to the field, including in just this last week, settling one of the long-standing and important debates in the WASH sector about whether or not the acronym WASH should have a lower or uppercase A. So thanks for doing that, Joe. I think it got the conference off to a really good start. Next up is Professor Federico Costa. Fede, if you wouldn't mind turning your camera on so people can see you. Federico is a professor at the Federal University of Bahia in Salvador, Brazil, where he leads a large and dynamic research group. He also holds an adjunct professorship at the Yale School of Public Health in the US. His current research includes investigating the mechanisms involved in the transmission of leptospirosis, the ecological and sociological factors that affect the likelihood of human and animal infection in Brazil, particularly in urban settings. And he also uses epidemiologic methods to evaluate the impact of different types of interventions, ranging from basic sanitation, but also to what we might think of as broader environmental sanitation interventions, such as rodent control and solid waste. Recently, I would just add that Dr. Costa has coordinated field and hospital-based studies in Brazil, in the city of Salvador, in response to epidemics, so the Zika epidemic, and then more recently in relation to COVID-19. So welcome, Federico. Our next speaker, panel member, is Dedo Mate Kodjo, who can maybe, if you could turn your camera on, please. Brilliant. Dedo is a development specialist with, she's 29 years, not 30, just short of 30 years experience in global health and development. Dedo has held senior leadership and management roles in various non-governmental organizations, and she's worked both in stable developmental or development settings, as well as emergency or humanitarian settings. Over her career, she's worked in West, Central and East Africa, as well as Central Asia, working with government, with civil society, as well as community-based organizations or other community structures. She's worked across lots of different development sectors, so education, health and nutrition, food security, and of course, water sanitation and hygiene. But I think across all of that has been a sort of steady focus on child rights, child health, and child protection. Today, Dedu is the Pan-Africa Program Manager at the large WASH-focused international NGO WaterAid. And I thought I would flag, she holds several degrees, but I thought the most relevant for today is that Dedu has a master's degree in leading innovation and change, which is very pertinent to our discussion today. I'm going to move on now to Professor Barbara Evans, who I think is appearing in her second plenary this week. So she'll forgive me if I sort of move quickly through her introduction. Barbara is Chair of Public Health Engineering at Leeds University. She's a very well-known thinker, researcher. She's been active at a policy level, at a practice level over the course of almost, I think, 35 years in the WASH sector. Her team at Leeds is multidisciplinary. She has won lots of awards over the course of her career, but a sort of nice point is the thing which she's most proud of is in fact not all of these awards, but is the cohort of brilliant early and mid-career graduates of the WASH training program that she runs at Leeds. And you will see many of them, I think, at UNC presenting their research. One thing to know about Barbara is she has a bee in her bonnet about what some people refer to as DIY, do-it-yourself WASH, but we're going to hear more from Barbara on that. So I'm just going to introduce now the last member of our panel, Professor Gagan Kang, who can please turn on your camera. Fantastic. Professor Kang is the first woman from India to have been elected as a Fellow of the Royal Society. She's also the first Indian woman to have been elected to the Fellowship of the American Academy of Microbiology, and the only physician scientist to have received the Emphasis Award in Life Sciences. Gagan Kang, or sometimes known as Cherry, received her training in medicine and microbiology at the Christian Medical College in Vellore in southern India, and is currently today a professor of microbiology there. Her research really focuses on enteric infections in children, particularly on the transmission and immune responses, particularly in order or with an eye to designing effective interventions. She currently leads studies with active hospital and community-based surveillance, as well as clinical trials of new and existing vaccines. The last thing I would say about Professor Kang is she was recently profiled by the Lancet journal, and there's a really nice quote in there, which is that at large meetings, and I think today is possibly a large meeting, she is never the loudest voice, but when she speaks, people listen. So maybe a lesson therein for our audience today. Okay, so I'm going to now introduce and sort of set the scene for our session today. UNC always delivers excellent plenary discussions, and this week is absolutely not an exception to that rule. I think some of the big issues which have been touched on may in fact be touched on in our session today, thinking, for example, of safely managed sanitation, some of the enduring challenges in high-income countries. But our plenary is slightly different, I think, to the other issue-based plenaries that are taking place this week. In our session, we're going to step back a bit, and we're going to ask whether this thing, which has become known as a sector and sort of under the banner of WASH, water, sanitation and hygiene, really has a future, at least as it's currently conceived. So what is WASH? Well, I mean, very broadly, it's a community of practice, it's a community of policy, it's a community of research, it's about a group of people and organizations. I mean, in essence, it is us. It is you, the audience, the type of people that come to the UNC conference. But it's worth thinking as well that this is a set of things which have been put together, a set of interventions, if you like, or areas of public policy that at some level have been assembled to address a problem or a set of problems, even if that logic is not always explicit and clear. And I think it's important, as we take a longer view of things, to consider this isn't fixed in stone. The WASH sector has not always existed, nor indeed has it always been called WASH. I remember going to conferences not that long ago where people talked about what's SAM, so there was no H at the end. So why would we ask this question now about whether there is really a future for WASH? Well, 4 reasons. Number 1, I think, is the Sustainable Development Goal. SDG 6, and particularly targets 6.1 and 6.2. The ambition of universal access to safely managed services was really a step change in ambition. I would say it's a goal that's really worthy of the 21st century. But half a decade later, the reality is that achieving that goal is a distant prospect at best. Secondly, there is a lot of new evidence, and much of that evidence features at this year and in previous years at the University of North Carolina. And at least some of that new evidence suggests that at least some approaches and basic low-cost technologies and interventions are failing to deliver significant health and social returns. And some may even be failing at the first stage of preventing exposure to sort of pathogens in the environment. The third issue is the backdrop of these, if you like, major challenges that are much bigger than WASH, but which will clearly impact on existing services, may make extending access more challenging, and which fundamentally WASH has a role to play in responding to climate change, rapid, often unplanned urbanization, growing social inequalities, increasing number of humanitarian crises around the world, antimicrobial resistance, to name just a few. The last point is around the scope or gaze of the global WASH sector. If we're absolutely honest with ourselves, the global WASH sector has been almost exclusively focused on low and middle income countries. And that suggests that WASH issues are no longer of significant concern in high income countries. The risk of this is that it draws attention away from the discrimination, including racism, that exists in relation to access to water and sanitation services in many, if not all, high-income countries today. But it also risks reinforcing an international architecture, an outlook that is still shaped by colonial legacies. So against this backdrop, over the last year or so, there have been many calls for reform, calls for transformation, in essence for change, and a strong sense that carrying on in the way we have always done things is not sufficient to meet SDG 6, and not sufficient to respond to the challenges of the day, and not sufficient to realize the full potential benefits of water, sanitation and hygiene, not just in terms of public health, but in terms of gender equality and social and environmental justice. So these are big issues and big questions. And we have picked a panel who I think are qualified and motivated to sort of tackle these big questions. We also want to involve the audience. So we have somebody who is keeping an eye on the questions and triaging them. And to the extent possible, we will try and feed those into the discussion and throw them at our panel. So please put concise points or questions in the Q&A box. And if you can, tell us who you are, tell us which organisation you're affiliated to and where you're based. So I'm now going to move to our panel, and I've got a first round of questions, and I'm going to start with Barbara. So Barbara, I hope you don't mind me saying this, you are something of a veteran of the WASH sector with decades of experience, and you've worked across research and policy and practice. You've ended up in academia now for, I think, over a decade at Leeds University, with a strong focus, I think, not just on research, but on education and training, and thinking about the future and thinking about future WASH professionals. So I'm going to go to you just to ask this question. We've got a big gap today between collective ambition at an international level and the actual reality in terms of access to safely managed, sustainable services. What do you think is missing? What do you think the WASH sector, do you think the WASH sector has actually faced up to the change that is required to deliver on the promise of SDG 6? And this is not a discussion where you need to pull punches, so don't sugarcoat it, Barbara. Give us your honest view on these big issues.
Okay, so it's a huge question. Thanks, Ollie. I thought of three things. I'm sure there are many others. And the three things which I thought of are historicity, which is a posh word, which I'll come back to, ambition in its true form, and a bit of humility. And I think they're really important things. So historicity, which is the sense of the fitness of things in time, is really important. I think we lack an understanding that a lot of time has passed since the WASH sector was first conceived, when drawers of water pointed out that what was being done in the 1970s was not the best approach. Funnily, we've not actually progressed our intellectual conceptualization of the sector very much since then. A lot of time has passed. The world isn't what it was in the 1970s. Most of the people who need sanitation and water services today live in either middle-income countries or in rapidly growing economies. Less than 10% of the global population live in extreme poverty. And we've failed as a sector, I think, to pay attention to the sort of demographic, economic, global changes which have occurred. So we're still functioning in a kind of emergency mode in many cases when we shouldn't be. So what that means is we often have the wrong strategy. The second thing is this idea of lack of ambition. I mean, the targets are very ambitious, but I think often I would perceive a lack of a proper understanding of the problem we're trying to solve. Sanitation, which is my field, is extremely complex. We need people who understand the public health, the environment, and the social development dimensions of sanitation in a much more sophisticated way than is often the case. And that's particularly true because now we have to deliver services that are going to be resilient to climate change and might even contribute to mitigating climate effects. So sometimes I think we're actually deploying the wrong skills. We haven't upskilled or changed our sort of skill profile over the period of time that's passed. And the final thing is humility, ironically. I really have concerns that sometimes in the WASH sector, we think we're going to change the whole world with sanitation. So I hear people saying this sanitation project has to eliminate poverty, eliminate misogyny, eliminate gender discrimination, solve the climate crisis, not damage the environment. I mean, we're freighting our sanitation projects, particularly with so much baggage. So if somebody says to me, oh, please find me a sanitation system that's going to be low cost, easy to manage, and is going to be suitable for a highly dense urban housing area that's frequently inundated with 2 meters of flooding, I'm going to say, no, that's not a sanitation problem. That's a social development and housing problem. And so to fix that as a sanitation professional, I need to be inside the housing department with the urban planners. So I feel like we've got sometimes the wrong strategy, sometimes the wrong skills, and sometimes I think fundamentally the wrong positioning to address the problems that we're trying to address. I don't mean to be too negative because there's lots of good pieces, but I think we're still trying to shoehorn all of those pieces into a conceptualization of the sector that is perhaps more fitted to a world which doesn't exist anymore, I would say.
Gosh,
I hope that was an answer.
That's a great start. You've really sort of flagged some important issues, and I think, you know, the wrong strategy, the wrong skills, and possibly the wrong positioning, and the model we have is not sort of fit for the world we live in today. I'm going to go next to Dedo, who could maybe turn her camera on when she responds. Brilliant. Dedo, you know, as I said, introducing you, you've got this sort of long experience in the field of sort of, you know, global development, global health practice, working in sort of different countries and regions, and within that, across sort of different development sectors. So not just this sector that we sort of refer to as WASH. Sitting as you do now within WaterAid, which is, you know, at least one of the biggest international non-governmental organisations in the WASH sector, what do you think needs to change within the WASH sector to deliver on this sort of high level ambition? More possibly than sort of thinking about, you know, normative standards, what level of quality of service is required, and more thinking, how do we change the model? How do we change the way we need to go about delivering on that ambition? I'd love to hear about your experience, but maybe also if there are insights from within WaterAid about how this sort of big organisation in the WASH sector is grappling with the challenge of SDG 6.
Right, thank you very much, Ollie, and it's a pleasure to be here today. I think, you know, WaterAid operates from the premises, the fact that, you know, water, sanitation and access, water, sanitation and hygiene are fundamental human rights. And so we would approach, you know, the work that we do from the equality, inclusion and rights framework. In everything that we do, we tackle inequalities in access, resource distribution, and decision-making in WASH. We use research, partnerships, and programming to understand the fundamental causes of inequalities in the experiences that communities have with clean water, decent toilets, and good hygiene. And of course, it's not just in a particular country, but intra-country and then within communities and households. We have a multi-pronged approach to this. And I like what Dr. Barbara said about, you know, being inside the housing department, because obviously, you know, addressing WASH is a multi-sectoral approach. So we have a multi-pronged approach. We work with governments, we work with communities, and we work with civil society organizations and even private sector. In terms of even understanding what is happening, you know, there are a number of tools that I'm sure other international agencies also use, and that would be a political analysis, a power analysis, to try and understand the gaps that are existing in access to WASH. Using the fundamental human rights to water, sanitation, hygiene is critical in order to be able to understand who are those who are missing out. And I think that's what we try to do. We also work critically with, you know, community groups, women's rights organizations, making sure that whatever is happening on the ground speaks to their problems, speaks to the things that they're grappling with, and then lifting those concerns into the district, into the district management committees, into the local government, and then building that further up. We also understand that delivering water, sanitation, and hygiene is not a, like Dr. Barbara said, one size fits all. It's important to identify where we're coming from and where we want to go to. In addressing some of the things that we do, we look at, you know, program implementation, we look at data, we look at, you know, who are those suffering, who are those marginalized by access to water. We look at, you know, who are the game changers within all that, within the sector. We look at, you know, innovation, we look at systems, we look at technologies that actually respond to people's needs on the ground. We also look at the fact that, you know, as a water and sanitation organization, you know, we don't have the wherewithal to do everything. So it's important that, you know, we're able to demonstrate through modeling and through innovation, things that work, and then document that and use that for advocacy, not just in country, but to be able to use it within the regional and continental fora that we raise our voices. So I think I'll stop there for now, Ollie, and then we'll add some more during the course of the conversation.
That's brilliant, Dido. And I'm going to come back to you actually on some of these points, but I want to get through a round where we hear from everyone on the panel first. So the next person I'm going to turn to is Joe. So Joe, this is how I'm going to characterize you. You have a foot in the global WASH camp. We see you in conferences like UNC, but you also have a foot firmly planted at home in the United States of America, which is of course a high income country. If we think about WaterAid and Dido's comments, we don't often hear from organizations like WaterAid about WASH challenges in countries like the US and in areas that you've worked in, like Alabama, or in urban sort of settings like the city of Atlanta. The global WASH sector, as I said before, is focused on low and low middle income countries, and suggesting that these issues in countries like the US are maybe not so important. What do you see in your research and work? And if I could push you to just sort of tell us a little bit about what you see is the relevance of the global WASH sector as it exists to the challenges you describe and work on in the US.
Yeah, thanks, Ollie. And thanks for raising this. I mean, as you said at the outset, we're not really a global WASH community because we don't have good links with high-income countries. So indeed, the business of WASH remains very much unfinished in the United States and indeed in other rich countries. I mean, just in the US, there are 500,000 households that don't have complete plumbing. Work that Drew Capone and others have led have shown that up to 1 million residents in cities don't have good sanitation. 600,000 don't have good access to water. A lot of the small systems that serve especially rural populations in the United States are poorly performing and share a disproportionate burden of health-related standards violations. These affect communities of color primarily, Black, Indigenous, people of color communities. And the US is not unique. I mean, the US happens to be the place where a lot of these disparities tend to be the most visible. I mean, we're the richest country in the history of the planet Earth. And we also have some of the poorest populations among any rich countries. So you can see, inequality very visibly. And, everybody saw the disaster in Flint. And indeed, you may have seen other, news stories about, communities in the United States that have been, that are challenged with these, with WASH issues, despite, having a lot of resources around. But these are not unique to the US. I mean, other high-income countries, have plenty of WASH issues, including in the context of, forced and otherwise migration in Europe, Indigenous communities, Canada, Australia, lots of places in high-income Asia still struggle. So, in terms of global WASH, I mean, it's not really, these issues are not really on the radar. Partly that's justifiable because the sort of scale and the public health burdens of problems associated with poor WASH in high-income countries are, nowhere near to the same degree as they are in low and middle-income countries. But they differ in scale and in context, but not really in kind. And sort of zooming out a little bit, the global WASH sector doesn't, WASH doesn't exist in high-income countries. Not only is our community not present in engaging with these kinds of issues, but that term is not used. I mean, we have different vocabulary, different preoccupations and assumptions. For example, around drinking water, it's all about chemicals. How many people at this conference are studying chemicals? Very much relevant to low and middle income countries, and something that we spend a lot of time worrying about in richer countries. We don't have a lot of data on the health impacts of those things, but what we do know is concerning. Right, there's a different policy environment, different policy landscape, And certainly, differences around the policy or the financing environment. I mean, you can't say in rich countries that we don't have the money to provide professionalized, high quality services to all the people who need it. That's an excuse that is often hid behind in all kinds of places, sometimes with justification, but often not. In the U.S., it's a different story. And the WASH space in general is very siloed in the US and in some other rich countries. I mean, there's the water community of practice and history and regulation, which is often very much separate from wastewater. But I think there's a lot of, looking broader and sort of longer term in this space, I think we can see, those of us who are working across these spaces, that there's increasing convergence, that's inevitable, but also it has benefits both for people working in higher income countries and also, people working in low and middle income countries, especially as we raise the profile of focus on systems and professionalization of services. And it's not just the things that high income countries can offer to poorer countries. The opposite is very much true as well. Breaking down silos and WASH, is something that I think the global WASH space can offer, higher income countries, certainly new modalities of more nimble infrastructure, including more resilient infrastructure that you can find in some of the middle income countries and low and middle income countries that would be good models, frankly, for extending infrastructure that last mile in places that are so difficult to serve, like where I'm working in rural Alabama, where we have one solution for rural wastewater in the United States, and it's a septic tank. And we've had lots of conversations about septic tanks here already. I feel like that's a major conference theme. Maybe there should be a side session just on septic tanks, but they don't work in big swaths of the United States. And where they do work, many of them are failing. So we need to think about ways of taking all the rich innovation from low and middle income countries and thinking about using that in ways that are going to advance that last mile in the US and other rich countries, doing more with less, and I think finally, I think it's really important for those of us who are working in global WASH, especially people who sit in high income countries like me, to always, I think, explicitly acknowledge that our work is not done here. It's not just about us focusing on problems that exist, among other populations in distant places around the world. We don't have to look very far to find these problems in the US and other rich countries. And I think if we don't see them, we don't know about them, it's because we're not looking, or we're not looking hard enough. There are lots and lots of data gaps around these problems. And that's one of the huge obstacles, I think, in generating momentum around these issues in higher income countries, but it's not an excuse, and I think we need to acknowledge that and lead with that, because it's an important context.
That's great, Joe. And you've covered a lot of ground, and I hope we can come back to it. I'm really pleased. We've got people now putting questions and reflections. Brian Reed, Remy Coop, as well. I'm going to try and come back to those once we've done a full round. Cherry, Professor Kang, I'm going to try and sort of segue from what Joe was saying to you in sort of thinking about India. It's a huge country in terms of land mass, in terms of population. There are, if you like, sort of subpopulations within India who are high income, middle income, low income. And since you've got that global diversity within India, and if I sort of maybe turn to you and just sort of, if I could sort of present you as, you're not a usual suspect for a WASH conference. You're a physician, you're a distinguished professor of microbiology, but your work is, I think, over the last sort of 3 decades, it's been singularly focused on the challenge of sort of reducing the burden of disease associated with diarrheal diseases. And you've sort of approached that from an environmental perspective, but also in terms of vaccines. What I'd be really interested to hear from you today is, there's a lot of new evidence, particularly around the sort of early onset and really, almost ubiquitous in some settings, acquisition of enteric pathogens, and the consequences of that in terms of sort of health, growth and development among young children. So I wonder if you could sort of maybe tell us a little bit about this sort of new science, some of the work you've been involved in with studies like MALI-D, and what for you are the takeaways and the lessons for the WASH sector, which at one level is trying to prevent that exposure.
So maybe I'll start, as Barbara did, with history, and I'll start with the history of diarrheal disease research. If we go back 50 years, 40 years, 30 years ago, everybody had a favorite bug. There were very few studies that looked at a range of different pathogens, and very few of them actually looked at anything more than basic demographic features. Now, at that time, when those studies were done, the tools available to scientists were also limited. So it's unsurprising that bacteria, which people could culture, came up as the top pathogens that were identified in people who lived in poor environmental settings. In the past 15 years, there has been an increasing focus on trying to do studies that integrate not only enteric pathogens, but also other features that relate to how children are infected, grow, and develop. And MALI-D was an outstanding example of that. There have also been interventional studies like WASH Benefits and SHINE that tried to show the benefit of WASH. And I have my own theories about why they didn't work as well. But in MALI-D, what we were able to show is that within quite homogeneous low-income settings across countries in Asia, Africa, and South America, children acquired pathogens very, very early. And the acquisition of those pathogens resulted in a high level of inflammation within their gut. And inflamed guts essentially meant that children were not able to absorb nutrients very well. And this led to both acute and chronic malnutrition. So what the new science is allowing us to do is to understand that the consequences of poor wash, poor water, poor sanitation, poor hygiene go well beyond just the acquisition of infections. It impacts your gut ecosystem, and new studies are looking at the microbiome and what early inflammation can do to shape the microbiome. And we have studies from our early cohorts where the children are about 20 years old now, where we clearly identified hygiene as a big risk factor in the acquisition of infections. And what we show in those studies is that children who acquired infections early, who became stunted early, have consequences that last their entire lives. These children are now graduating school. The ones who were chronically stunted have lower IQs, perform less well in school examinations, and are less likely to find employment than others. And here we are not even going into what happens in adolescence in young girls and the damage that can be done if you cannot have appropriate menstrual hygiene with the number of infections that these girls then acquire. So the consequences of WASH are huge. I think I mentioned SHINE and WASH Benefits earlier, and I'd just like to say that when we do research, we do it in communities that we think matter to us, the poorest and the worst off. We are not comparing them to rich people within the same countries. And as you go into more homogeneous populations, it becomes more and more difficult to show an effect within that study. So when we think about research in the future, I think our design should account for the fact that showing differences will become more and more difficult over time, and we should be paying attention to that.
Thank you, Cherry. That was just, you know, a brilliant sort of summary of, well, research over the last sort of 30 or 40 years. I was very struck by your sort of characterization of the early sort of WASH epidemiologic literature, where, if you like, we didn't have the methods to look at the level of specific diarrheal diseases or to really characterize sort of interventions and sort of risk factors. But the methods and the science has moved on, and it is shedding light where previously there wasn't light. And it's incumbent, I think, on the sector to use that science, those insights, to really develop sort of more effective interventions, but also maybe to recognize the scale, as you said, of the long run consequences of sort of poor water, sanitation and hygiene played out over the lives, you know, not just in childhood. I'm going to turn next to Federico. Fede, I think you're somewhere between the WASH sector and the not WASH sector. I think if I was to sort of put a label on you, I'd definitely call you sort of environmental health. But my sense is that WASH, as we talk about it in conferences like this, is maybe a little bit limiting in terms of the work that you do, which certainly sort of spans into environmental sanitation, things like sort of solid waste and other interventions. I wonder if you could just talk a little bit about your sort of experience, your view, working in a sort of large city. I think Salvador is about sort of 3 or 4 million people. It's a middle-income country, Brazil. There are a lot of people who have access to basic services, and at least some people who have access to safely managed services, but there are persistent health and social challenges relating to environmental health. So I think my question to you is, do you use the term WASH in your work at a research level and a policy level? And does that sort of grouping make much sense in a city like Salvador in the face of the challenges you see today?
Thanks, Oli. Difficult question, but happy to give a try. So I confess that we do not frequently use the term WASH in our local context. I think that there is a couple of reasons for that. One is that in Brazil, as in so many other countries, there are different scenarios. And in Brazil, we have existing legislation that for universal access to what we call in our definition basic sanitation, which includes water, sanitation, and waste collection, but it's a different ministry that the health Ministry of Health, and that do not create good connection between the two sectors. The other thing is that from the public health perspective, probably because in the real world, the basic sanitation doesn't have, it's very heterogeneous in coverage, and also it's very fragmented in the service. It's very hard to integrate those components to specific disease prevention strategies. So in line with Dr. Kang was mentioned, very complex to use this model. And especially if you think in the large number of circulating diseases in those urban settings, if you think in vector-borne, zoonotic, reservoir diarrheal diseases, all with different route of transmission, different social environmental determinant, a specific strategic prevention, which doesn't usually have a good fit with some of the more classical WASH interventions. No? And so, our group works specifically in the urban slums, urban vulnerable populations, as mentioned, usually known as favelas. And I would like to think a little bit on leptospirosis, which is a very specific disease, but also I think that help us to think on WASH as an example of that. And I like that because when you think in leptospirosis, which affects like a 5% of the residents of those communities, and you think the determinant, you have proximity to rats, proximity to areas that are flooded several times a year, low education, low socioeconomic status, usually affects more African descendant residents. So how you address all these animal, environmental, social determinant, economic is from a WASH perspective in some class of a compartment on that. And usually what happens at the end is that we are very ambitious in the goals, but very simplistic in the strategies. So at the end, the government, what it does is more palliative strategies like a road control or educational campaigns to avoid contact with flooding water, which in fact are ineffective and not really doesn't make very sense because rat population in those areas is very high because the environment is perfect for those reservoirs, and you cannot avoid flooding water if you can afford a house, to live in a house that is not flooded 3-4 times a year. So, and I think that's the main issue is that the current public strategies for leptospirosis, but also for other diseases, do not prioritize those structural more broad or more general intervention. And I think that that is what Barbara in some ways was mentioned in a more integrated way. And for example, just as a compartment of that, in our communities, even when we have good water coverage, only 50% of the population is connected to network sewerage. So in fact, there is a good opportunity for cheaper and cost-effective interventions that improve the access of those sanitation systems in these highly density areas. Or for example, solid waste collection, improved solid waste collection in those areas where there is not easily access, and which are the main reason for these localized but frequent flooding events inside areas where you do not have a good sanitation or drainage system. So I think that those points is the ones that came up my mind in the first moment.
That's great, Fede, and I really took from your intervention this. I think you said our ambition, our goals are sort of big and simple, but our interventions also are inadequate, reductionist. They don't reflect the challenges, the diversity of settings, and the fact that there are many things which fall outside of the traditional sort of WASH sort of toolkit, which are, you know, extremely important. And, you know, the picture you sort of painted from Salvador really illustrated that. I want to go from that and that sort of, you know, sort of disconnect between sort of big, ambitious, complicated, highly context specific challenges, and then maybe, you know, the sort of simple packaging of WASH. There's a question that's come in from Nikhil Patil. I'm just going to read it out. Taking a long view of WASH, if the next generation of graduates are interested in WASH and want to be involved in helping to achieve SDG 6, what are the skills and knowledge we should encourage them to learn whilst in school? Do we need more engineers? Do we need data scientists, computer scientists, lab techs, policymakers? What is it that we need? It would be nice to say all of the above, but what are the critical skills of the future that this sector needs in the generation that is coming through? I'm going to go to you maybe first, Barbara, just quickly. What's your sort of thought on that?
Yeah, it's a great question. Nikhil's hit the nail on the head. I mean, yes, all of the above, but fundamentally, I think we're even quite reductionist in our training. And you mentioned somewhere about sort of, you know, distilling things down to a tiny sort of crib sheet or whatever. We actually need to train people I mean, it doesn't matter what we train them in. We can train microbiologists, we can train technicians, we can train. What we actually need to do is train people to apply critical thinking to solve the problem that's in front of them. Picking up on something Cherry said, you know, we know actually quite a lot about the way disease moves around in communities. In a particular place, we need to have an understanding of that in order to be able to work out what's likely to be an effective intervention. If we invest all our energy in sanitation, but actually, you know, in toilets, but actually the real problem is people are using the wastewater to irrigate their lettuces, we're not going to see a health improvement. So critical thinking skills across all of the disciplines. I mean, I love what Nikhil's written here, and I think this long view idea. We're training people today to solve problems we don't even know exist yet. There'll be more pandemics, there'll be new diseases. We've got to train people to solve those problems. That would be my ambition. Also, you know, we try and do it at universities. It's hard. You need energy, you need resources to do that.
I'm going to go from you, Barbara, sitting in an institution where you train sort of people. I'm going to move to Gagen, who an organisation that is involved operationally and is hiring sort of young professionals. So David, what's your sort of take on this question, sort of sitting in WaterAid?
Yeah, thank you very much, Ollie. Thank you very much for the person who gave that question. I think the bottom line is that even as professionals and technocrats, we have been removed from the communities with whom we work. And so in addition to all the technical and professional skills, we need to be able to, you know, speak to communities through a rights-based lens and through a gender-based lens. Because fundamentally, these are the things which our professionals lack. And that's one of the things, some of the tools that WaterAid applies in the work that we are doing. We look through the problem through the gender lens. We have our technical people, we have our WASH experts, we work with governments on that to address that. And then also, what we're talking about, we use the rights-based approach, applying the knowledge, the local knowledge, being able to tease that out to be able to support whatever innovation and sustainability that the WASH sector needs to do. So for me, those are the two critical things, using a rights-based approach and having a gender-sensitive lens to address WASH. Thanks, Ali.
Thank you. I'm going to come to Cherry and Fede in a second and ask them about researchers and research disciplines and sort of future generations. But I want to go to Joe first about and building on Deirdre's point about understanding the communities that these sort of interventions and programs and policies sort of take place or target, and a sort of lack of understanding or a sort of disconnect between sort of professionals and communities. I mean, maybe you could talk a little bit about your work in Alabama, you know, as an example. I mean, how do you sort of make sure that you're understanding the context, responding to that, working with communities themselves, but also bringing, you know, what you do in terms of sort of research and science?
Yeah, I mean, I agree with all of this. I think we need critical thinkers and we need people who really understand communities. And I think one thing I tell students is to try and find problems to work on in your own, where you're from, you know, and I think that's been, for me, it's been enormously enriching. I think too often in our sector, people approach new problem spaces and communities as blank canvases where history hasn't happened and where you know, the policy context and the interconnections between all of the various systems are sort of unexamined. And I think that's always a mistake. I mean, as we zoom out increasingly in the WASH space, we're grappling with complex systems, right? We're grappling with complex actors and histories. And I think we need to understand all that. Like I tell my students who are going to work in rural Alabama, where I'm from, that they need to be reading some William Faulkner as part of their preparation. They need to understand that disagreements and conflicts and, you know, racist policies and things, you know, they go back 100 years, and sometimes the problems that you work on have a lot to do with the history of a place, you know, and things evolved in a certain way for reasons that you need to understand if you're going to be there trying to change things. So I think, yeah, I mean, I just second all of that. I think it's really important that that's part of training and also part of practice in our space.
Thanks, Joe. Just quickly, maybe I'll ask Fede and then Cherry, just sort of thinking about sort of researchers, what do you see as the sort of needs for the sort of next generation of researchers in this field? Oh, sorry, maybe Fede first and then Cherry.
I really like what Barbara mentioned about critical thinking. And I think that the point of having a next generation of researchers that can interdisciplinarily work with different approach is critical for independently of the background of the person. And in our personal experience, in our group experience, we have been recently in epidemics from Zika, chikungunya, COVID in the last 3-4 years. And basically it's the same group of students that, or the researchers that we work and adapt to these different systems and try to provide answers all from the transmission route to the impact, characterizing the impact, as well as providing strategies to prevent the transmission and also to manage the consequences of the disease. So I think that specific people that have a broader view can work in different areas independently of their background and have a good field experience at both hospital and field is important. Even it seems like a little bit generalist, but I think that is what we work in our sites.
Great, thank you, Fede. Cherry, over to you.
So I'm going to talk about 3 areas that I think are critical. The first one is especially applicable to India, but there will be aspects of it relevant to other countries as well. And this relates to social sciences in the WASH sector. I think if we are to change the way people think about WASH, think about the role of WASH in society, we need to engage much more with social scientists, which we don't do sufficiently. In India, of course, you know, we have still have the maximum number of people who practice open defecation. And if you talk about belief systems, about why that occurs, that really relates to the idea of purity. It extends to the idea of the caste system. So without social science research, we are not going to get anywhere with that. The second area I want to talk about is something that I referred to earlier, which is understanding the consequences of poor WASH more holistically, that allows us in a way to calculate the full value of better WASH systems, again, to model and to potentially influence policy. When you make economic arguments in favor of investment in WASH, that is speaking the language that policymakers understand. Just telling them about bugs doesn't really do very much. The last area I think I would like to focus on is the idea that investment in science for WASH makes sense. I can use an example again from India, which is a new program that has been thought about but re-announced this past week, which is called Waste to Wealth. This has been implemented to a large extent in China, which kind of takes the lead in that area. But the idea of what can you do with human fecal waste that maximizes its value? And that, I think, is one approach to science. There's also lots of other aspects that relate to the WASH sector that would be relevant, but it's really to apply the highest quality science to the area so that it becomes more and more something that policymakers will accept. And the reason that I focus on policymakers is because we've relied too often on passing on the consequences of poor WASH in low and middle income countries to individuals. And that allows for systems, governmental systems, to kind of abdicate what is their responsibility. So whether we talk about septic tanks or we talk about water storage within households and telling people how to safely store drinking water in their households. What I don't get is, why are we not actually telling municipalities that you need to make sure that everybody has drinking water every day instead of once a week or once in 2 weeks? So I think there is a lot that we can do from a research perspective, but it does need to be more integrated than we've had so far.
We've got under 10 minutes to run now. This is a brilliant discussion. Lots of people are saying it's a brilliant discussion. So carry on, panel. There are two words which have come up. I'm going to sort of point to Mirameta, but others have used the same words, which is really meaningfully shifting to wash services and the role of utilities at different scales. And I just maybe go very quickly, maybe start with you, Barbara. What do you think about this? Sort of, do we need to shift to a focus on sort of services that sustain over time and the role of utilities in providing that? Is that something that's missing or hasn't been sufficiently elevated?
Yes, absolutely is. And I think this idea of service and a public sector responsibility, I think Jerry's just highlighted it as well. I don't mind if the organisation who come to your door is a private organisation contracted by government or a public service utility. What I mind about is that the state takes responsibility for this. Jerry's just highlighted this unbelievable health burden. A third of the world's population have geohelminthic infections, more or less. I mean, like, what are we talking about in the 21st century? I think that number's still true. Hope it is. So yes, I think we have to see it as a public sector, and the service thing means we have to focus on the ongoing service liability, not the construction of the infrastructure. So when we start designing projects, the real question is not will it cost me, not how much will it cost me to build this piece of kit. The real question is, how am I going to levy the revenue from user fees or taxes or whatever that will operate this service for the next 30 years? And we know what those numbers are, more or less. They're not small, but they're also not big in the context of what we're talking about here in terms of the health impact. So yes, I absolutely couldn't agree more with Mira and many other people in the chat. It's a public service obligation that we're talking about. Yeah.
Brilliant, Barbara. Joe, the spectre of public goods, public services, the role of the state. I mean, does this speak to you with your work in places like Alabama or in the city of Atlanta or other parts of the US?
Yeah, I think it raises some big questions, though. I mean, like, I think it's all well and good to say we need to stop focusing on households and start focusing on utilities and service provision and systems. But in many places, including where I work in Alabama, I guess I'm wearing my Alabama hat today more than anything else. The public sector is broken. It's completely broken. And because there are a lot of, not everywhere in Alabama, but the places I'm working, there are reasons why, services are not being provided, and they are, based in racism, they're based in poor planning, they're based in, all kinds of broken systems. So the real question is like, okay, we can all say that we want to focus on systems, but what are we going to do for people in the meantime? And I think that's an important set of questions. I'm not sure this panel has an answer to that, although maybe they do. But yeah, I think it's absolutely critical for us to really think about the balance between where we spend our time advocating for fixing systems, which, I mean, let's be honest, this is a decades-long project here. We're not talking about any quick changes. And I think we need to be realistic about that.
Realistic, and I think Barbara's word at the beginning, humility, in terms of the scale of the undertaking. I'm just going to go very quickly on this point about public goods and moving to a sort of service, sort of utility-based models, and maybe ask Dado for her sort of take on this and how an organisation like WaterAid is thinking about this. But just quickly, please, because I want to. We've got
yes. Oliver, this is a very critical question because I've been in a situation where, you know, in the urban center, utilities are planned, but in the rural sector, you know, we're asking rural communities to do their own, you know, delivery and acquisition for water, sanitation, and hygiene. So fundamentally, if you're looking at utilities, then it is important that we use utilities to address inequalities in wash access and to alleviate poverty. There was a comment in the chat box about, you know, the uses of water, and it's true. It's not just for drinking; it's for a whole myriad of things that we need to look at in terms of what the impact it has on the individual and the individual's household, and of course, affordability for them as well. So yes, looking at it to alleviate poverty and to address inequalities and inequalities that impact on women and girls as, you know, a cohort. Thank you, Oli.
Brilliant. Fede, just quickly, if you come in on this point.
Yeah, I also agree with the previous panelists, and especially with Dedo, about the importance to integrate and these national efforts for improving basic sanitation. In Brazil, the budget has been cut in half right now, and the universal coverage is now estimated to be delayed maybe 4 years in order that everyone has sanitation. So there is no way that we can move if we don't have access to those specific systems. But at the same time, because of the more general approach, that needs to be done integrated with other structural changes, for example, social programs like cash transfer programs, and also locally with local engagement programs to improve the participation of the community in those areas.
We've got 3 minutes. I'm going to ask each of our panel in 30 seconds to respond to 2 questions. I want you to let us know, do you think there is a future for the WASH sector? Number 1. And number 2, if this conversation is really about change and the future, can you tell me one thing that we either need to stop doing or one thing that we need to start doing? Okay. I'm going to start with Joe Brown.
Is there a future for WASH? I think so, yes. It's going to look very different from what it looks like now. I think it's going to look very different because the science is moving. It's going to look very different because of, you know, globalization and convergence across countries. And I think it's going to focus increasingly on delivering services. And I think one thing that we need to stop doing is focusing on very, very small scale interventions and focusing on systems. I mean, right? I think small is ugly rather than beautiful.
Brilliant. Thank you, Joe. Cherry, could I ask you to go next?
Is there a future for the WASH sector? I don't see how we survive without it. So I don't think that is really a question. What should we be doing? I think using the science and expanding it as much as possible to be able to focus on the economics of WASH. Somehow we have just not been able to make that case. And I think it is critical that we keep doing that. The SDGs are an opportunity. I don't think we are using them well enough at the moment. One thing that we should stop doing is, I completely agree with Joe, that we really need to scale and not focus on individual responsibility for this.
Perfect. Dido, could I ask you to go next?
Okay. Yes, it's fine now. The future question has been answered by Cherry and Joe already. But one thing we should stop doing is putting water, sanitation, and hygiene in a straitjacket. I think today's panel has made it clear that, you know, access to water and sanitation and hygiene are critical outcomes to address inequalities in health, education, and social development. And the one thing that we should start doing is strengthen the gender and inclusive lens that we use to address WASH. We must hold government's feet to the fire and help them to set up and implement strategies to challenge the obstacles and discrimination that we see in WASH access in the countries that we work in. Thank you.
Thank you very much. Fede, just very quickly, because we're running very close to the wire.
Yeah, I think that one thing that the WASH sector can be make better or can do is to improve the scope to emerging diseases, the ones that are responsible for the next epidemics and pandemics. And when you look backward, the same responses for those pandemics are the same that you use for the provider day by day for the classical diseases. So integrating those views, but strengthening the thing that we need to do by our services that are basic services.
Brilliant, thank you. But I didn't mean to give you the last word, Barbara, but I think you've got it. Okay,
super quick. I don't think WASH is a sector. I think we're a group of people that meet in places like this, but we come from our own sectors, which might be conceptual, engineering, microbiology, whatever, or they may be development, housing, rural development, whatever. And that's great, because that's what we're saying. We need this knowledge and information to be embedded in actually big, no countries or very few have ministries of WASH. So it's good that we're a sort of slightly complex sector. One thing we need to stop doing is saying that WASH is expensive. WASH is not expensive. We need to spend about 1/100th of what we spend on building new cancer hospitals to solve this problem, but the disease burden is enormous. So if I could wave my magic wand, I would say, could we all go out tomorrow and say, this is a really cheap, difficult, but cost-effective intervention. It's not expensive, in my opinion. And it's essential if we're going to be resilient to climate change, resilient to future pandemics, all of those things.
Brilliant. Thank you, Barbara. We are going to have to close. I think this was a really big question and a really exciting discussion. And there's been lots of sort of questions spinning off in the chat box discussion. So I hope those discussions will continue through the course of the conference. I just want to say a really big thank you to our panel by not being intimidated by the title of this this session and really engaging with it and sort of thinking outside of the box and thinking big. So thank you, all of you. I will clap you virtually. And I'm going to officially close the plenary part of our session. And I'm going to move on to the next part, which is an award ceremony. I don't know if the organizers can help me with that in terms of slides. Excellent. Thank you very much. So the next part of the session is a ceremony, an award, which is the Jeroen Ensink Memorial Prize. If I could have the next slide, please. I'll talk in a moment about Jeroen, about Dr. Jeroen Ensink, but just to say that Waterlines is a journal that many of you will be familiar with. It's been a sort of kind of keystone journal, I would say, in our sector. It is a journal which really sort of focuses on kind of bridging the gap between the field or practice and research. And the journal focuses on the key challenges facing engineers, health professionals, community development workers, researchers, and policy makers in this field. And it aims really to inspire productive conversations to solve challenges in water, sanitation, hygiene delivery across the world. Now, Waterlines established the Jeroen Ensink Memorial Prize in 2016 to commemorate the life and work of a former Waterlines editorial board member, Dr. Jeroen Ensink, who tragically died in December 2015. Throughout his career, Dr. Ensink sought to apply science and research to improve the lives of those who in the 21st century still live without access to safe drinking water and sanitation. He pursued this goal via different paths. He was a practicing public health engineer. He sort of worked as an engineer in sub-Saharan Africa, in South Asia, in different countries. Also as a researcher, initially as a doctoral student at the London School of Hygiene and Tropical Medicine, and then later on in his career as a senior investigator leading sort of large, important sort of environmental health studies. I think at least in my relationship, my friendship with Jeroen, the thing which really gave him the most pleasure was in teaching and mentoring. He's a wonderful educator, a wonderful teacher. He really inspired sort of many sort of students to go on to become WASH professionals and to become WASH researchers. And he of course left an impressive legacy of scientific work, but I think his true legacy is possibly in his students and colleagues. And just this morning, I finished reviewing the sort of final version of a doctoral thesis, which is about to be submitted by a master's student of Jeroen's. She studied as a master's student, I think she graduated in 2013. He inspired her, encouraged her, pestered her to consider to do a PhD. And just this morning, I had the privilege of reading her thesis, which was very much sort of picking up important questions that Jeroen himself had sort of put out there as sort of big questions and hypotheses. So I'm going to sort of stop there, and I'm going to invite somebody very special to say a few words about Jeroen. And I'd like to say one thing, which is quite sort of serious, and then one thing which is sort of more light-hearted to try and get the tone right and put our speaker at ease. So the more serious thing is I'm going to invite Nadia Ensink Teach to speak. Nadia was Jeroen's wife. She sort of knew intimately about his sort of career and work. We certainly had many dinners together where she looked like she'd maybe heard a little bit too much about WASH research and the politics of the London School. But I just want to reassure her, because Nadia just wanted everybody to know she is not a WASH expert. So don't worry, Nadia, we're not expecting you to deliver a scientific presentation here, but it would be really nice to hear from you about maybe a little bit about sort of Jeroen's legacy and maybe what this award, and I know there are other awards as well celebrating Jeroen's sort of life and work. So over to you, Nadia.
Thank you, Ollie. Yeah, well said. I have absolutely no formal background in WASH, but by now I know quite a bit about WASH, and I really enjoyed the panel discussion. It's like I was right back to a few years ago when Jeroen was still with us, Ollie and Joe sitting in our living room in London and discussing into depth, a little bit too much at times, but I enjoyed it. So yeah, thank you for inviting me. I'm not sure if all of you know, but Jeroen was stabbed to death when he posted the cards of our daughter Fleur. That was back in December 2015 when Fleur was 11 days old. In December, she's going to turn 6, and I sometimes wonder where where the time has gone and how we got to where we're now. But let me take you back a few years ago to our first holiday in Tanzania, when Jeroen actually took me to sample pit latrines for the Bill and Melinda Gates Foundation. That was our first holiday together, and that set the tone for many more field trips to come across Asia and Africa. And I had no idea how interesting sanitation was. I never even thought about it because it just wasn't my field. But Jeroen, as a self-proclaimed shit engineer, made it incredibly interesting and even sexy. So I enjoyed all the trips. I enjoyed all the dinners we had in our living room and well, pretty much anywhere. Yeah, Jeroen could have chosen a different career path. He definitely could have chosen an easier career path. He could have chosen a career path where he could spend more time with his family and friends at home, but he didn't. And he spent many years in Pakistan, India, and Sri Lanka. And at times it was a very lonely experience. And I've asked him if he had to do it all over again, he would do exactly the same. So while friends at home got their first proper job, their first proper paycheck, Jeroen was still getting by on a very meager research stipend. But he'd do it all over again. And in the field, he experienced firsthand what he learned in books. He saw with his own eyes how little adaptation could change the life of many, many people. And Jeroen was definitely shaped by his work, but he was also shaped by his supervisors. They saw talent and they nurtured talent. And that is exactly what Jeroen did later when he provided support and inspiration to his students. And many are now successful researchers and public health professionals in their own right. And that makes me incredibly proud. Jeroen definitely was a man on a mission, and he was very attractive to me. He loved his work, but his family always came first. And becoming a dad is definitely his greatest achievement ever. And it still breaks my heart, and it will forever remain broken that he only got to share Fleur's life for 11 days. But people only die when we forget about them, when we stop talking about them. And that's definitely not the case for Jeroen. He lives on in our memory, be it professionally or private. And while Jeroen was ever the diplomat, he definitely didn't mince his words. And he fascinated his audience with bad jokes. And it still happens quite regularly that somewhere in this world, two strangers meet either at a conference like this or at an airport, and they find out they both knew Jeroen. And then out of this meeting, something new was born, a new research project or a new paper. And it still amazes me that even now, Jeroen manages to connect people and to inspire people. So shortly after Jeroen's death, together with the London School of Hygiene and Tropical Medicine, we set up the Jeroen Ensink Memorial Fund to ensure that his legacy continues. And so far, we've just awarded the 5th MSc scholarship. And back in 2016, Waterline also approached me to set up the Jeroen Ensink Memorial Prize. And every year I have the honor to read the nominated papers. And I can't even begin to express how incredibly proud it makes me that together we commemorate Jeroen's life and his mission to change the world for the better, one step at a time and in a very practical manner. Giving birth to Fleur and being married to Jeroen are definitely the best things that ever happened to me. Losing Jeroen was the hardest. But this whole experience made me into the person I'm now, to the mother I'm now, to the person who cherishes every moment that life gives us and who chooses to see the light despite the darkness. And moments like these move me so deeply, and I know that Jeroen is incredibly proud, but he would also be way too humble to be standing in the limelight right now. So I'm handing back over to Ollie, who's not only a colleague of Jeroen, but also a good friend of ours. and he'll hand over the award. Thank you all.
Thank you very much, Nadia. I think everyone respects your sort of courage and eloquence in speaking, and I think your words will be an inspiration for many early career researchers here at UNC. So it's a bit peculiar doing this virtually, but I'll do the best I can. But it falls upon me to make the award via my computer screen for this year's winner, which was a paper that was sort of led by sort of Bonifaz Okoch, with a team that included Elsie Gadir, Ahmed Elsimat, Liberdad Gonzalez, Jan Higa, and Giovanna Dodos. And the title of their paper was, "Are ceramic water filters effective in preventing diarrhea and acute malnutrition among under 5 children in Sudan?" It's open access, it's on the journal, so please do read it. And I would just say on behalf of the selection committee that included Jeroen's brother, Robert Ensink, but also Clarissa Brocklehurst at UNC, Patrick Moriarty at IRC, and Mike Templeton at Imperial College. The committee felt that the topic was very important in terms of sort of WASH and severe acute malnutrition. It was operationally relevant, and this study really sort of added to sort of growing literature around how WASH might be part of more effectively treating children with severe acute malnutrition. And it definitely, for us, spoke to some of the passions, some of Jeroen's own sort of research sort of passions and interests. So I'm going to hand over now to the team. I'm not quite sure who's going to sort of speak or receive the, oh, Libertad, sorry. Over to you, please.
Thank you, Oliver. Hello to everyone. My name is Libertad Gonzalez, and I'm representing here the group of the authors for the winning article of this year. I think Giovanna and Bonifaz, they are with us, so maybe you can wave as well from your camera. I'm also representing the organizations, the Netherlands Red Cross and the Sudanese Red Crescent, that funded and implemented the project that provided the operational basis of this research. We are very honored to be here and very grateful to be the recipient of this award in the name of Dr. Ensink, who made really a great contribution to applied research in the WASH sector. Some of us receiving the award today in the group of authors actually grew up professionally reading the Waterlines journal and fantasizing that someday we would be publishing in there. And we were also students at the school where Dr. Ensink was a senior lecturer and investigator. So it's really an honor receiving a prize that associates both names, Waterlines and Dr. Ensink. So thank you very much. We are very happy to know that the selection committee felt that our study addressed an important issue in the WASH field, in particular the relation between malnutrition and access to safe water. With this study, we tried to explore how promoting the use of inexpensive household water filters would contribute to tackle malnutrition in children under 5 years old. I think we all agreed that we did not answer all questions around this research topic, but we want to believe that we took one step ahead in building knowledge that will guide future interventions. We are also very satisfied that the prize is given to an organization like the Red Cross, Red Crescent. We know that we are not a very strong academic research organization. We don't have that profile as we are pure field practitioners, mostly working in emergency setting or complex chronic crisis setting. Most of the time, our funding, timeline, capacity, focus, and also the mandate do not always allow us to engage in operational research, but this time was a little bit different. So we are proud to have invested the resources, the time, and the personal effort in advancing the research agenda around WASH and malnutrition, and to be recognized for that. So thank you very much. Just to finalize, I want to thank the authors of the study, with Bonfaz here, who guided the study in Kassala, in Sudan, investing a lot of his personal time in this study. Also our colleague Elsir, who is our counterpart in the Sudanese Red Crescent, and who made possible that all those Sudanese Red Crescent volunteers supported the project and also supported the study. And just to say thank you to all of you in the conference for being with us today, honoring the legacy of Dr. Ensink and helping us to give visibility to the importance of safe access to water in reducing malnutrition. So thank you very much.
Yeah, thank you. Yeah, thank you very much, and congratulations again to everybody that was involved in the paper. And everyone, please do go to the Waterlines journal. It's open access. Read the paper. But yeah, congratulations to the author group. I'm now going to sort of thank all of the sponsors. I'm not going to read them all out because there are too many, but yeah, thank you to everyone that sort of contributed to making sort of UNC a success this year. And I think the organizers would like me to just flag that there is the Young Professionals Careers in WASH event that's just started. So please do join that. And I think it's sort of a very nice sort of event following on from Nadia's words and the award. So I'm going to close there and just thank everyone for joining.